Okay, I think it's slightly past 12:30. Has everybody had a chance to have a little bite to eat?
Yes, thank you.
Yeah, we're back and ready to go.
Great, thank you. Karen and staff ready to go?
This is Sarah. I think we're ready to go, except I think we may need to get Dr. Lai reconnected to his audio. DCA moderator, am I seeing this correctly? He's not connected to audio, correct?
Yes, this is a moderator, and it looks like Dr. Lai is not connected to audio. So Dr. Lai, if your computer does not have a microphone, you can go to Communicate at the top of your screen and select audio options, and there's a way to connect with your phone. And we'll give you a moment to do this.
Board staff are reaching out to Dr. Lai, but it looks like he just reconnected.
Looks like he's on.
All right, Ross, are you with us?
Yes, sir.
Excellent, thank you. Okay, let's go ahead and go.
Let's go.
Okay. All right.
We will now move on to agenda item 12A, the Western Regional Examination REB report. And I believe we have Dr. Bruce Horn, Director of Dental Examinations for the REB, to present this agenda item. Welcome, Dr. Horn.
Thank you. I assume all can hear me well?
Yes.
So as far as REB is concerned, we've currently examined, let me give you a today report here, and then I'll certainly be available for questions. But we've currently examined about 350 California candidates at Western, Loma Linda, and University of Pacific. Things have gone rather well. The candidates have adapted to their new protocol, their new social spacing requirements, and have been very cooperative with all the COVID protocols that both the school, city, and state have put in place, and that we have asked to be available to us as examiners and staff get to the schools. The pass rates that we are able to discern at this point, after almost 400 candidates, 350 of the California candidates, show that there is no significant statistical difference between the pass rates of 2019, when we had a patient-based operative component, and the simulated component that we're offering this year. Our examinations were completed at these three schools with proper screening. Each school had they had questionnaires, temperature taking, as you can imagine. The areas were marked very well for the candidates to be able to social distance themselves, both at breaks and as they queued up to enter the pre-clinics. This queuing continued with both entering and exiting the building. And also we were able to administrate the examination in a way where we had good spacing in the preclinical lab. And to accomplish that with a larger group of candidates, we created more sections. So the examination actually lasted a little bit longer, if you will, for examiners and staff. The candidates had the same number of sections. They were fewer in each section, so we could accommodate that spacing. PPE was in use, mask at all time, gloves, eyewear. Barrier was up to the school itself and the availability. A few schools have requirements for barrier for the students. Other schools, that was relaxed due to shortages locally. We were able to grade the simulated sections on site at a few schools. Things are getting a little, they were getting a little easier for us to send examiners and fly them for a while. Now that's reverting. It's changing a little bit right now. In fact, yet for us to examine are the candidates at UCSF, USC in the form of 2 examinations, one in July and the other one later in August, and also UCLA. WREB is in communication with the schools in the city county of Los Angeles to determine whether we can safely gather examiners, staff, and candidates together to provide a non-patient examination. I just checked today, and the 7-day average in positive testings in LA County is up 8%, and the hospitalizations right now are increasing on a 3-day curve. So I guess the virus will dictate whether we can get to these schools to examine the candidates, or we'll have to postpone that until later. Currently, we're prepared to offer the non-patient-based exam again next year for states that are requiring that. There are a few states that are having discussions about returning to a patient-based format. But again, I think the virus is going to dictate this, and these decisions will be made at board meetings and then probably reassessed as things change or not. So it's been an interesting year, and I'll my final comment before questions would be that I will tell you that a lot of candidates, more than 10, more than 20, have commented to us about their appreciation for the Dental Board of California offering them an alternative to finish their matriculation and move through their testing in a way where they can launch their careers in whatever way they can these days. So I hope those comments have made it to you as well.
Thank you, Dr. Horn. Sounds like it's all going very well.
It really is. It's going smoothly, and the candidates really the COVID class of 2020 is really adapting. I think this will carry them through their whole careers, their ability to adjust and adapt, and with good attitude. So it really is. It's going as smoothly as it can. Just safely getting people together and getting access to the facilities where we can examine will be the challenge for the remaining California schools.
Thank you, sir. Let's open this up to any board member comments or questions.
Dr. Stewart, do you see Dr. Morrow and Dr. Lai have their hand up? And Dr. Phelps as well?
This is Dr. Morrow. Is Dr. Horn still on?
I am Dr. Morrow. Thank you.
Yes. First of all, I want to tell you how much we appreciate WREB stepping up to the plate and developing an alternative non-patient-based examination for use this year. And as you know, California has accepted that, as well as the patient-based exam. At this point in time, look at the number of our students are asking, how many states are currently accepting the non-patient-based results of the WREB examination for licensure? And secondly, from the data that I received, limited data that I received from the pass-fail for this most recent WREB examination, that actually the highest fail rate on any one of the sections is a non-patient-based endodontic examination, which has basically always been a non-patient-based section. And we had some concerns regarding, obviously, the non-patient-based operative exam. From the data that I received also, that was the fail rate for the Mannikin-based, non-patient-based operative exam was pretty consistent with past history from a standpoint of fail rates for that section. Do you have any comments on this?
Well, I will tell you that the endo section consistently, the non-patient-based simulated endo section, has always been the most discriminating of our sections. And that waxes and wanes depending on training, practice. I do have some anecdotal, not evidence, but knowledge that because of the inability for the candidates to get into the preclinic during, COVID shutdowns of the institutions, that their ability to practice with the CompeDont teeth in the sim lab may have affected their ability to successfully complete the endodontic section the first time. Dr. Moore, you probably know that if the candidates on site fail the endodontic section and it is not by critical error, it is not treating the wrong tooth, for instance, or causing a perforation or major tissue damage, they're permitted a retake on site. On retake, there's a high percentage of those candidates that become successful. So that would be my only really thought about the endo section, and we kind of see that each year. The endo section first time passing rate is probably somewhere around 92, 91%. The first time passing initial attempts on operative this year for the Mannikin, the non-patient based operative section, and I had Dr. Pop pull up some numbers for me in case I was asked. The percentage rate at, let's say, Loma Linda was 96.2%. In 2019, the patient-based, it was 96.6%. So again, statistically not significant.
Right, that's basically the same data that I had received.
Dr. Stewart, your microphone is muted. And just so you know, Ross Lai is in the queue and Dr. Felsenfeld is in the queue.
Yes, Dr. Lai, thank you.
Thank you, Dr. Stewart. Hi, Dr. Horn. How are you doing?
Hi,
Lai.
Dr. Lai. I'm doing fine. Thank you.
I have basically two questions. One, and I'm going to present and ask ADEX later the same question, is that if in the event that we omit live patient forever and go to Mannikin-based examinations, is WREB geared to also developing an exam for RDAEF, since that's basically a clinical exam on a live patient? Because I think that's a point that we may need to address if this continues.
Well, my information about that topic is that there was some discussion maybe 2 or 3 years ago with OPES, I believe, wanting to inquire as to REB's ability to offer and develop and offer a non-patient-based written exam for, I believe, that group. And I think REB responded to that positively, but I think that administratively, that whole issue kind of got placed in limbo. I listened with interest today, this morning, as that came up again. So to complete that discussion, it would just be a matter of REB being asked to help develop that in any way we can. And I guess that would be through OPS.
Okay, great. Second question I have is, if we did go back in with live patient exam, kind of a hybrid, would REB also take the California portfolio into consideration and administer that exam for us?
That's a great question, and we have certainly looked at that. At one point, there was some discussion with Comera, and there are some hurdles with administrating the portfolio the way it is. I think there was some discussion among maybe a dean or two and some others on the board about creating a hybrid, and that hybrid would include both the activity that REB currently validates to examine and the details that are within the portfolio concept as well. I think that would take a commitment by both the board specifically engaging us to do that. It seems like these discussions before have been tangential in that it has either been a dean or two at a school that has engaged us in discussion, but we've not really wanted to be the Bodinsky on something that you're trying to develop and that you're trying to administrate. However, if asked, we would certainly be willing to engage.
So I'm thinking in regards to where REB would contact each dental school, because I think that would probably be the binder, because a lot of dental schools are reluctant to put energy and time toward the portfolio. So that was the problem, and in the past few years I've been involved with it. So yeah, thank you for that.
Dr. Felsenfeld, sorry.
Thank you. Dr. Horn, Alan Felsenfeld, good afternoon, sir. Thank you for your report. You indicated quickly, I have a quick comment, actually two quick questions. You indicated at the beginning that the passage rate for the non-patient-based exam was pretty much identical to that for a patient-based exam, and you also indicated that in the endo section, those numbers were the same. Is that correct then?
In the operative section, I'll just repeat, and I have results for, I'm speaking with Loma Linda in respect to Dr. Morrow here, results from Western UOP, and then the other schools are going to follow. But since Dr. Morrow and I both have the same data for Loma, in 2019, the percentage of passing first time was 96.6, and then in 2020 with the non-patient-based OPSIM, 96.2 is our result, and that's over 112 candidates.
That's operative. That's the entire exam, not just endo then.
No, that's just operative. For the entire exam, that data I can certainly provide to you. I asked Dr. Pop to give me the operative SIM section that they had available, but as far as overall, we'll certainly provide that to you as you need it.
All right. The other part of my question is you very quickly, and I didn't quite understand what you're saying, said there was a problem with PPE or said something about PPE. Could you elaborate on what you were saying there?
Right. So the protective equipment at the schools, when we're administering the non-patient-based exam, we're requiring masks at all times, as you can imagine, gloves, and certainly eyewear. What is available at some schools in great quantities that's not available at other schools, is barrier wear, the gauze wear that we're wearing in our offices. So, due to the shortage of that in certain areas, we're certainly requiring that the candidates wear appropriate scrubs, lab coats, and so forth. But as far as completing the whole COVID precautions that we would use in our offices, we're not requiring that the candidates consume the gauze barrier wear if it's not available freely. That seems to be in short supply in Texas and some other schools as well. That's all I meant.
Thank you.
Dr. Lauren?
Hi, thank you for being here. I just had a question about the comprehensive treatment planning exam. I know last board meeting we discussed it was okay to eliminate the hands-on part. And I just wondered how it's going for the students. How are they taking this exam? What is the difference between that exam and, as far as how they're receiving it? How are the students receiving that exam? How are they, what did they think about it?
Sure. So the comprehensive treatment planning section of the WREB exam is it's a written exam, yet it's a constructed response. So there isn't a series of multiple choice questions. They cannot select answers from A, B, C, or D. They're giving 3 treatment plans that include periodontal patients, various severity, and they're to make diagnosis and reevaluation, surgery referrals, and so forth. And they're to describe that to us based on the case documents that they're presented. To specifically answer your question, the CTP, Comprehensive Treatment Planning Examination, is offered in the fall. So most of the candidates in California have already taken this examination in a window that is assigned to their school. So each school has a 3-week, much like the Joint Commission National Exam, they have like a 3 or 4 week window into which they can register a Prometric and take the comprehensive treatment planning exam. Most of the candidates have done very well on that. There are some candidates that for whatever reason will prescribe inappropriately or prescribe a very problematic dosage of either an antibiotic or pain medication, or they will their treatment plans will be incomplete or create other critical errors that would cause them to fail the exam. But for the most part, that has gone very well.
But so are you saying that the students that already took their exam, prosthodontic part and operative, have they not taken it, or they're not going to require to take it?
They took it in the fall. So when the candidates register to take the WREB examination about this time of the year, and usually it's by August 1st, they register to take the WREB exam, and of the things that they're registering for is also CTP. So they're registering to take CTP, they get a candidate number, and we give them a window based on the school that they're at to go to Prometric to challenge the CTP exam. So the candidates that our 2020 candidates took CTP in the fall of 2019. So that's already in their portfolio of completion, if you will. And then, so their chart, if you will, includes CTP, and now they must complete operative in whatever format the state requires, endo and pros.
Okay, so that's done at an examination site, not at school, correct?
Not at the school, correct.
Okay, thank you very much.
Thank you, Dr. Lauren. Any further board member comments or questions, Dr. Horn? Okay, seeing none, public comments.
This is the moderator. Thank you, Mr. Board President. I will go ahead and open up the question and answer panel. All right, the Q&A panel is now available. If you would like to make a public comment, please type, "I would like to make a comment," and submit it to the host in the lower right-hand corner of your screen. If you do not see the Q&A panel, please click on the square or question mark within a square in the bottom middle of your screen. And we are displaying instructions on the slide. This is the moderator, and Mr. Board President, I am seeing no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, and thank you, Dr. Horn, for being with us today. Thank you.
Thank you.
Dr. Lauren, you might want to take your hand down. All right, thank you. We will now move on to agenda item 12B, the American Board of Dental Examiners, the ADEX report. Dr. William Pappas, President of the ADEX, and Dr. Guy Champagne, Vice President, will present this agenda item. Thank you both.
Thank you, President Stewart and board members. I bring greetings from the American Board of Dental Examiners. Over 3 years ago, development began on the CompeDont, a simulated natural tooth for use in dental licensure examinations. A tooth with simulated enamel, dentin, carious dentin, affected dentin, and pulp. In the fall of 2019, a series of pilot exams were held at dental schools around the country to compile data for a mode effect study comparing the use of the CompeDont with the patient-based operative examination. The psychometric data supported the use of the CompeDont in making licensure decisions in place of the patient-based operative examination. ADEX was scheduled to review for possible approval this testing modality at our August 2020 annual meeting, but due to the COVID-19 crisis, a special meeting of the Dental Examination Committee and of the Board of Directors were convened in April, and the CompeDont was adopted. As you have heard, the CompeDont was not developed due to the crisis. Rather, it was fortunately available at this time. The CompeDont utilizes the same criteria set for evaluation by 3 independent examiners, just the same as the patient-based examination. This bears repeating. The same criteria used to grade the patient-based exam are used to grade the CompeDont. The CompeDont has been adopted by 33 states for use during the COVID-19 crisis to date. 18 of those states have adopted the CompeDont for use beyond the crisis. The CompeDont has been offered or is scheduled to be offered at 33 dental schools around the country. Regarding the periodontal portion of the examination, scaling has not made the cut score in the last 3 occupation analyses dating back over 15 years. That means that practitioners in the first 5 years of practice are delegating scaling rather than performing scaling. Therefore, recognition, diagnosis, and treatment planning of periodontal disease are the important skills to be evaluated. The psychometrically validated periodontal examination of the ADEX Dental Licensure Series is included in the DSE OSCE, the computer-based exam, and the longest-running independently maintained OSCE in dental licensure. With your permission, President Stewart, I would like to ask Dr. Guy Champagne to provide a look at the data that has been compiled during this examination cycle. Thank you.
Thank you. Thank you, Dr. Champagne, for being with us as well.
Thank you for having me. I'm assuming you can hear me. I unmuted myself, but I never had a mic test. Am I working?
Yeah. Yes.
Okay, great.
Very good.
As Dr. Pappas alluded to, this was developed as an alternative to patient-based exams with an intent as an alternative to patient-based exams and hopefully to even improve the process. I do want to let the California board know, though, that we are still giving patient-based exams, believe it or not. So at the 33 plus dental schools we've gone to, some of those are purely patient-based exams, and some of those are mixed patient-based and CompeDont exams, because the way the ADEX portfolio works, you could do the procedures on either the approved simulation or a patient. Now in California, of course, we are exclusively non-patient-based exams, so that hasn't happened in California. The pass-fail rates on the restorative exam, because that's really the only new components, the CompeDont restorative exam, it is within 1%
of the previous year's historical data on patient-based exams. More importantly, it's within 1% of this year. We were fortunate. 80% of ADEX candidates nationally, which is about almost 2/3 of the graduates in the United States, had completed the ADEX exam before the COVID crisis hit, because we give it in a curriculum integrated format. They were able to complete that before that would ever happen. So our focus was on the remaining 20% of candidates. Because we've developed this as an alternative to a patient-based exam, we wanted to do an analysis. Are we getting the failures for the same reasons? And I don't mean this, whether it was caries remaining or issues like that, but are we identifying, is the exam functioning the same way? So one of the things that we looked at psychometrically in the cohort this year is what predicts someone's success. Is there a component of the exam that is important? And happily, what we found out was that the modification process and approvals of modifications or denials of modifications are the best predictor of a candidate's success. In other words, the candidate has to recognize the disease state, recognize the clinical situation, identify what they want to do and why to alter from so-called ideal preparation to extend further, and all of the CompeDont teeth need modifications. So the lowest pass rate, interestingly, is if you've had all your if your modifications have been denied, not because of penalties associated with the denial, but because you've done a treatment later that was inappropriate. The second lowest pass rate is if you have mixed modification requests, some accepted, some denied. The next lowest is no modification requests because you didn't recognize there was caries there. And the highest pass rate is all modifications granted, and it is all of those are independent of the number of modifications. So it's the fact that if you demonstrate incorrect diagnosis and judgment and poor treatment planning as far as altering external outline form, internal outline form, et cetera, that is what is going to determine whether you are going to pass or fail, which we found very heartening that this was not a technical task. We were evaluating judgment. We were evaluating the candidate's ability to adapt to the variability of the disease state. So that's a really positive output, outcome of the examination. We've also done surveys from every exam. We've, at this point, about 1,200 candidates have completed the CompeDont simulated exam. As we explained to candidates and others, this is not a CompeDont tooth. This is a simulation of a human tooth. The materials are not the same. It is not made in the same way. It feels the same as a tooth. It cuts the same as a tooth. The caries feels the same. What I found the most important feedback were actually practicing dentists who were taking the ADEX exam to go to a state that requires ADEX. Usually it's within the first 5 years, but there are states like Florida that do not have licensure by credentials, so they might be going to Florida or Hawaii. The comments that they gave of how the fidelity of the simulation was very impressive for them. So it has turned out that it's functioned very well. It is a permanent alternative with ADEX, as Bill alluded to. About half of the 33 states that accept, over half of the 33 states that accept the CompeDont simulation accept it permanently. It has nothing to do with the COVID-19 crisis. They view it as a appropriate alternative to patient-based participation in the examination. And with that, we'll be happy to answer any questions.
All right, thank you, Dr. Champagne. Let's open it up to board member comments or questions. Okay, I see Dr. Morrow and then Dr. Lai.
Yes, thank you. Thank you, Dr. Champagne. A question to ask you. I want to make sure that I understood correctly what you were saying. That in your experience with the ADEX examination, that the best predictor from a standpoint of a pass rate would be the request for modifications and the appropriate modification requested. Is that correct?
Yeah, so the way we give the CompeDont exam is identical to the patient-based exam. There are no differences. So modifications are evaluated by grading captains in the back anonymously. They have no contact with candidates, and then based on those modifications, when the graders apply the criteria, they're altered. So if you could reduce the axial depth was 2.5 millimeters from the DEJ and they granted another millimeter, it would be 3.5. So what we looked at this year, so I can't answer historically because we haven't looked at that before, but one of the things we wanted to look at is the CompeDont functioning the same way as the patient-based was the role of modifications, because on the CompeDont exam, unlike a patient-based exam, you cannot choose an ideal lesion that just cutting an ideal prep and the caries is serendipitously gone. The caries extends in all three axes and promulgates along the DEJ. So you have to ask for modifications. You have to say, I'm going to alter the external outline form, alter the internal outline form, where you want to do it and why you want to do it. When we looked at that functioning, rejected modifications are the highest predictor of not being successful. So you either could not diagnose the situation because your modification could be rejected because you said there was caries and there wasn't, or you wanted to do something that was not acceptable, or your judgment, what you planned to do about your diagnosis was incorrect. Though it wasn't the penalties associated with the modification rejection because they didn't really affect the outcome. It was that someone had an inappropriate diagnosis and judgment. So yes, that is an interesting component of our analysis this year, that the modification process is the best predictor of a candidate's success.
Okay, basically, I think what I'm hearing you say is that the success is more based on clinical judgment rather than on lack of hand skills.
Yeah, well, I would like to say that is the case, but we don't know that. So we don't know. Yes, rejected modifications is either a poor judgment or a poor diagnosis.
Right.
But what I don't know, and I don't think we didn't look at that, whether even that being the case or not, is that associated with poor hand skills? And this poor hand, because this doesn't totally identify that cohort who is going to be unsuccessful. There are people who have all modifications accepted who are also unsuccessful. They just happen to have the highest pass rate.
Okay, appreciate it. Thank you.
Dr. Lai.
Hello. Dr. Pappas, Dr. Champagne, thank you for joining us today. Same question I had with WREB prior to your presentation was, if live patient goes away and we don't have this anymore, how is ADEX equipped to help us with the RDAEF examination, which is a clinical exam in California? And that was my main question.
Yes, we would definitely work with the board on that. We already give a dental therapy examination. So yes, we could certainly work with the board on that.
Thank you very much.
We do the expanded duty and dental therapists in Minnesota, Ohio, and 3 other states right now. So that's something that's currently done.
Okay, thank you. Thank you, Guy. Thank you.
Any further board member comments? All right, let's go to public comments, please.
Thank you, Mr. Board President. This is the moderator, and I will open up the question and answer panel. All right, the Q&A panel is now available. If you would like to make a public comment, please type, "I would like to make a comment," and submit it to the host. If you are not seeing a Q&A panel in the lower right-hand corner of your screen, click on the question mark within a box at the bottom middle of your screen, and we are also displaying instructions for you on the slide. And we have an individual identified as AW that would like to make a comment. So I will let you know when you've been unmuted, and please remember you have 2 minutes. All right, AW, you've been unmuted.
Hey, thank you so much for taking my question. My comment is regarding the specific date of November 15th being the acceptance of the ADEX exam. There are a number of individuals who have graduated this year and who have taken the ADEX exam with all or portion of it before the November 15th date, or as in my case, last year's graduating class who've taken the ADEX exam in 2019, but it was sometime before the November 15th date. And for many dental students, this clinical exam is probably one of the most stressful days, and it ends with probably one of the most rewarding days. But now, just less than a year afterwards, we're asked to retake this exam all over again. And for those who've taken it, parts of it before the November 15th, it brings up the question, how can a part of the exam be accepted and not the other when they've been taken very recently? Also wanted to know if there was, in addition to all this, there's difficulty in, for those of us who have graduated, because there's priority to the current students, which makes sense. If you have already graduated and are trying to take ADEX or WREB, you are on a wait list. I myself can attest that I've been on the wait list for UCSF, USC, UCLA, for the WREB, and also ADEX for USC, and have been on the wait list for quite some time with no hope. Has there been any discussions about those who've taken the exam in 2019, but prior to the 15th, maybe getting some leeway with all the situation going on right now? Thank you so much.
Thank you for those comments. Do we, I'm going to ask Sarah or Karen, do we need to respond to that right now, or that's going to come up in a future item later today?
Dr. Stewart, this particular candidate has already received a response from the board, and it will not be discussed today.
All right, thank you.
All right, this is a moderator, and we have no further requests for public comment. Mr. Board President, would you like me to close the Q&A panel?
Please.
All right, I will do that. Thank you.
All right, we will now move on to agenda item 12C, update regarding Office of Professional Examination Services Review on the WREB Mannikin-based exam and ADEX CompeDont examination. I will ask Sarah Wallace, Assistant Executive Officer, to present this agenda item. Thank you, Sarah.
Good afternoon. This is Sarah Wallace, Assistant Executive Officer of the Dental Board of California. At the May 2020 meeting, the Dental Board of California staff provided a report on the interruptions to the administration of licensure examinations for the 2020 dental school graduates. I'm sorry, I'm just going to mute my computer. As a result of the coronavirus pandemic. Prior to COVID-19, both WREB and ADEX had utilized patients for their two respective examinations. In an effort to respond to the interruptions in the administration of the licensure examinations, both WREB and ADEX developed examinations that do not require patients for the operative and restorative sections of the examination. These are known as the WREB Mannikin-based examination and the ADEX CompeDont examination. As a result of the discussion, the board directed staff to work with OPES to review these two examinations to determine if they could be accepted for licensure. Subsequent to the May meeting, and after further discussion with DCA, OPES, and Board Legal Counsel, it was determined that the board can accept, without further action necessary, the REB and ADEX mannequin-based examinations for dental licensure in California. Additionally, it was determined that the REB comprehensive treatment planning examination and the ADEX periodontal scaling examination, which are administered on a mannequin, satisfy the required periodontal portion of the examination. And the ADEX DSE OSCE also satisfies the required periodontal portion of the examination. This information was posted on the board's website at the beginning of June, as well as updates throughout that month. While OPES was not required to complete its review of these examinations prior to the acceptance of them for the dental licensure in California, OPES committed to completing the review by the end of June, and the findings of their review are now included in the board meeting materials for the board's review. There's no action requested at this point in time. However, OPES evaluated whether the non-patient-based examination formats meet professional guidelines and technical standards. The evaluation included a workshop with subject matter experts, and based on the results of the evaluation, OPES found that the alternative non-patient-based examination formats offered by REB and ADEX are viable alternatives to the historically patient-based examinations. We also have Dr. Tracy Montez and Dr. Heidi Linser available to answer any questions from OPES. Dr. Stewart, if you'd like to take any questions, and then
yes,
go from there.
I'm sorry. I see Dr. Morrow's hand up.
Right. Thank you, Dr. Stewart. I just wanted to make sure that I understood correctly that the Office of Professional Examination Services is stating that the non-patient-based mannequin examination is not limited just to the COVID crisis, but is a examination that is recommended that we accept moving forward. So basically what they're saying is that California will approve for licensure either a patient-based or a mannequin-based REB examination. Is that correct?
That is my understanding of what has been provided by OPES, but I will defer to Dr. Montez and Dr. Linser to further explain.
Thank you.
This is Dr. Montez, Tracy. Yes, ideally it would be nice just to go to the non-patient. We feel that that would help standardize, but certainly if you feel it's in the best interest of your students to have an option, that's fine as well. But we do think the non-patient offers a more standardized approach to testing and is also much more practical and safer moving forward.
Thank you much. I appreciate that. Unfortunately, I understand, and I don't know for sure what they are yet, but there are some states that will not accept the non-patient-based REB examination or the non-patient-based ADEX exam. So in that situation, there very possibly will be or can be some graduates from the now 7 dental schools in the state of California that might need to take a patient-based REB or ADEX exam in order to get licensed in their state of choice.
Correct.
Okay, so that's something we're going to have to work out moving forward. From a standpoint of just administering both mannequin-based as well as patient-based. And is that something, and maybe if we still have the ADEX people, Dr. Champagne and Dr. Pappas, would it be possible to schedule an examination at the same time, at the same location, that would be both patient-based and mannequin-based based on the choice of the candidate?
This is Guy Champagne. We're doing that right now.
Okay.
So we, in fact, right as we're talking at the University of Minnesota, candidates can do any combination of patient or non-patient based exams or do everything if that's what they want. So because of the diversity across the country and the chaos that COVID-19 has created, we feel it's an obligation to allow, and there's no additional fees. So the candidate can do as many of those parts under the same examination fee as they need to complete their portfolio. We're fortunate because we're up to 33 states, and I think that number is going to grow, and there's almost 20 that are permanent. So I think we're on the move toward a non-patient based exam, but I think you're absolutely right. For at least the short-term foreseeable future, our plan is to offer both types of exams wherever the host school will allow it.
Good. Thank you very much.
And this is Tracy Montez again. Perhaps, knowing that California is accepting non-patient and sees this as a very valid procedure to move forward, other states may join in and change their regulations to allow non-patient in anticipation of other circumstances that could potentially come out and be proactive. Because certainly with California being such a large state and being as diverse, they may look to us for guidance. And given that WREB and ADEX do have two very strong examples of non-patient based examinations, this could be the way of the future.
Good. Thank you very much. Appreciate it.
Thank you, Dr. Morrow. Any further comments from board members? I see no hands raised. Then let's move to public comments.
Thank you, Mr. Board President. This is the moderator. I will go ahead and open the question and answer feature. All right, the Q&A panel is now available. If you would like to make a public comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions for your reference, and we'll give you a moment to access this feature. This is the moderator, and I am seeing no requests for public comment at this time. Would you, Mr. Board President, would you like me to close the Q&A panel?
Yes, and thank you, Dr. Pappas and Champagne, for being with us today. Thank you very much.
You're welcome. Thank you, Dr. Stewart.
Mm-hmm. All right, we will now move on to agenda item 13A, review of dental licensure and permit statistics. I will ask Tina Valerie to present this agenda item.
Good afternoon. This is Tina Valerie, Chief of Administration and Licensing. This memo provides an overview of the dental licensure and permit statistics. On page 1 of this memo, you will find a table that indicates the number of licenses that are active, inactive, retired, disabled, canceled, and delinquent, as well as the number of licenses in the process of renewing. Beginning on page 2, you will find a breakdown of licenses issued by year and by pathway to licensure. An overview of the different permits have been issued and the number of active licenses by county in an effort to identify shortage areas. Beginning on page 4 of this memo, you will find a breakdown of applications received, approved, canceled, withdrawn, and denied, along with the number of licenses issued. And I'd be happy to answer any questions that you may have.
Thank you, Tina. Any board member comments? I see Dr. Chan has his hand up.
I have a couple of questions. This is Dr. Chan. Where does the special permit for faculty practice fit into the categories of licensure, dental licensure? Is that active or is it a separate category?
I'm sorry, Dr. Chan. Could you elaborate just a little bit more? I'm not following the question.
The question is that there are licensure for faculty in by special permit in facilities that are connected with the dental schools. Maybe Dr. Morrow can help us to explain what that means.
Thank you. Dr. Chan, this is Karen. I
Hi.
think that you'll see that under permits. You'll see those statistics under permits. So the active licenses are dental licenses in the first box. And on page 201, if you go over to the license permits and certification registrations, those are separate. So at the very bottom, it addresses the special permits.
Oh, thank you.
You're welcome.
The second question is, how does the new health core, the California Health Core, fit into this licensure? Because they have a category for dentist in there.
I'm not sure, again, Dr. Chan, this is Karen. I'm not sure exactly what you're asking. So are you asking that, because the Health Corps essentially recruited some retirees to come back into practice? Is that where you're going with this? Or
Yes.
out of state? Or I'm not sure where you're going with this.
Both.
And do we have, Sarah and Tina, do we have any records of current licensees who moved over into that arena?
So the information, this is Sarah, the information that we have as a result of the waivers that were put in place by the Director of Consumer Affairs to reinstate licensure, we've had one application for a DDS that would have fit into that category. So one DDS.
And apparently, from what I've read, it's only active during the emergency. Only temporarily active during the emergency, correct? Or
there
not?
is a time limit on the reinstatement of the license, correct?
So it's not a significant number that we have to look at.
No, there's only one dentist that has applied.
Thank you.
Been approved.
Thank you, Dr. Chan. Any further board member comments or questions? Seeing none, let's go to public comments.
This is the moderator. Thank you, Mr. Board President. I will open up the question and answer feature. All right, the question and answer feature is now available. If you would like to make a public comment, please type, "I would like to make a comment" in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions for your reference, and we'll give you a moment to access the feature. This is the moderator, and Mr. Board President, I see no request for public comment at this time. Would you like me to close the Q&A feature?
Yes, please.
All right, I will do so. Thank you.
Thank you, and we will now move on to agenda item 13B, general anesthesia conscious sedation permit evaluation statistics. See, I will ask Jessica Olney, licensing analyst, to present this agenda item.
Good afternoon, Dr. Stewart and members of the board. I'm Jessica Olney. Before you, we have the statistics for the general anesthesia, conscious sedation, and medical general anesthesia permits for June 2019 through July 2020. Page 1 of 4 contains the general anesthesia permit statistics. Page 2 contains the conscious sedation permit statistics. Page 3 contains the medical general anesthesia statistics. And page 4 contains a graph as well as the number of current evaluators per region, which is broken between Northern and Southern California. I'll refer back to Dr. Stewart if there's any questions regarding the numbers.
Thank you. Thank you, Jessica. Board member comments, questions? Seeing none, let's move to public comments.
Thank you, Mr. Board President. I will go ahead and open the Q&A panel. The question and answer panel is now available. If you would like to make a public comment, please type, "I would like to make a comment," and submit it to all panelists. We are displaying instructions for your reference. This is the moderator and Mr. Board President. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Thank you, yes.
All right, it's done.
We will now move on to agenda item 14A, 2020 tentative legislative calendar. This is informational only, and Gabriel Nevin, the board's legislative and regulatory analyst, will present this agenda item. Thank you, Gabe.
This is Gabriel Nevin, legislative and regulatory analyst for the board. Can everyone hear me?
Yes.
Okay, thank you. Sorry, it's hard to tell if I'm unmuted or not. So this is the updated legislative calendar for 2020. I should note that it was revised on May 6th, and this is the first time that the board has seen it, but there is no action necessary at this time. Are there any board member comments?
I see no hands up.
All right. Are there any public comments? DCA moderator, can you please facilitate lines for public comment?
Of course, this is the moderator. I will go ahead and open the Q&A panel. The question and answer panel is now available. If you do not see it, click on the question mark within a box at the bottom middle of your screen and you'll see it to your right. If you'd like to make a comment, please type, "I would like to make a comment," and submit it to the host. We are displaying instructions on the slide. All right, this is the moderator, and it looks like our webcaster is experiencing some technical issues, so we will pause here. It will give people more time to type in any comments, and we'll wait for the webcaster to get things corrected.
Okay, I believe it's 1:52. Are we all on board to keep moving?
Absolutely.
Yes.
Thank you.
Yes.
Thank you,
Available.
Dr. Stewart. The glitch has been repaired and we're ready to go.
Excellent, excellent.
Let's do it.
Oh, okay. Let's see. We are on agenda item 14B, discussion and possible action on legislation, and I will ask Board Member Fran Burton to facilitate this agenda item. Is Fran with us?
My board says she's muted.
Okay. I kept getting a notice saying you may not be able to do that because you were working on stuff. And so I was having this I was having a staff meeting with myself. So before we move on, I wanted to talk a little bit about the calendar and just ask that you ignore that because things are so fluid right now because of COVID. You may or may not know that some members of the assembly have tested positive and there was a member in the hospital. And so the Senate, the assembly had been in session, went back out of session. They will return on 8/10, August 10th. The Senate will return on August 8th. The one thing that is still set in stone is the final recess will be August 31st. And so what that means is there are going to be some other provisions. This morning I heard a news report. The details, I can't give you the fine details of it, but I can tell you that the Assembly is looking at a process where members will be able to vote for each other if a member is in a committee and something is happening on the floor, or if a member is absent. So having said that, then let's move to next item, 14B, I'm sorry. And the first item on your list is AB 1613. We are not going to have a discussion on that because most of the provisions that were in that bill have been amended into another bill that we will discuss at a later time. And so for all intents and purposes for us, this bill 1613 has gone away. The next bill is
I'm
AB
sorry,
19.
Sorry,
Yes.
Fran, I think you misspoke. It's 613 because staff heard 16.
Is that what I said?
Staff heard 1613, so we just want to make sure.
I'm sorry.
That's okay.
Okay. 613. The next bill is AB 1998. And Gabe, I'm going to ask you to give us information on that bill.
All right, this is Gabriel Nevin, Legislative and Regulatory Analyst. The board reviewed this bill in February. 1998 is expanding the unprofessional conduct related to reviewing a patient's most recent diagnostic and conventional radiographs before performing orthodontic procedures. And so this bill is going to add the amendments that were put in on June 3rd are going to add that a new radiograph or other equivalent bone imaging must be ordered if no radiographs are available before conducting correction of malpositions of the teeth. The bill also, there's a current requirement that if upon patient request that identifying information related to the health provider's license number and address of record and practice address be provided to them. This before treatment is provided. This bill is going to make that previous requirement was based off of a patient request. This bill will make that information, will require that that information be given to the patient regardless of the request at the time of a recommended treatment plan. The existing laws also requires a patient, prohibits a provider of dental services from requiring a patient to sign an agreement limiting the patient's ability to file a complaint with the board. The amendments to this bill that you guys haven't, the board hasn't seen, will extend that prohibition to all of the board's licensees and unlicensed dental assistants. So they will no longer be allowed to sign an agreement that limits their ability to file a complaint with the board. And finally, there's an existing law that requires the licensee to comply with a request for dental records from a patient. And this bill, currently there's a monetary fine when a provider fails to comply. And this bill would specify that that would be unprofessional conduct to fail to comply with a request for records within 15 days. This bill is going to add additional conduct to the definition of unprofessional conduct. The fiscal impact of this legislation is anticipated to be minor and absorbable. Staff are recommending to continue the watch position from the February meeting.
Okay, I would like to move a watch on this bill. Is there a second?
Second.
And is that you?
Yeah, James. Yeah.
Okay. Are there any board member comments? Hearing none, are there any public comments? DC moderator, can you please facilitate lines for public comment?
Yes, thank you. I am opening the question and answer panel. So if you would like to make a public comment, the Q&A panel is now available in the lower right-hand corner of your screen. If you're not seeing it, please click on the question mark within the square at the bottom middle of your screen. And we are displaying instructions on the screen. And we do have one request for public comment from Mary McCune. Mary, I will let you know when you've been unmuted. All right, Mary, you've been unmuted. You have 2 minutes.
Hi, this is Mary McCune with the California Dental Association. Respectfully urging that the dental board take a position of support on AB 1998. Gabe did a really good job of outlining all of the consumer protections that this bill does and also clarifies other consumer protections, especially around the radiograph requirement for orthodontic treatment. That was in a past bill, AB 1519, which is, as you all know, the sunset bill from last year that the dental board also supported. And with those reasons, we respectfully request a support. Thank you.
Thank you, Mary. All right, this is the moderator, and I see no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
All right, I'll do that.
I'd like to ask the board secretary to call the roll on AB 1998, please.
Okay, this is Joanne Pacheco, Secretary, calling the roll on 14B, AB 1998. Motion by Burton, seconded by you, and a position of watch. I'm going to call the roll. Burton?
Yes.
Burton?
Burton, yes.
Aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, no.
Felsenfeld, nay. Lai?
Yes.
Lai, aye. Laren?
Yes, Laren.
Laren, aye. Mackenzie?
Yes.
Mackenzie, aye. Medina?
Yes.
Medina, aye. Morrow?
Morrow, no.
Morrow, nay. Olage?
Yes.
Aye. Olage. Pacheco, aye. Stewart?
Stewart, no.
Stewart, aye. You?
You, yes.
You? A. 9 yes. Motion passes. There was 3 nay.
Thank you. Okay, the next bill is AB 2028. And this is a bill by Aguiar Carey. Gabe, would you please give us a presentation on this bill?
Yeah, so AB 2028 is a bill that the board has seen before. However, and this is the bill that would require, the previous version that the board had seen before was going to require that meeting materials be put online 10 days in advance of the meeting. They have altered that requirement in this draft of the bill. It will now require that the materials and writings associated with the meeting be placed on the internet at least 48 hours in advance of the meeting or on the first business day after the day the materials are distributed to the board members, whichever comes earlier. And it also adds the requirement that the materials be provided immediately upon written request. It does allow a safety valve against the 48-hour requirement, allowing updates related to active litigation and changing financial market conditions after the deadline. The board took an opposed position in May, excuse that typo, and staff are recommending a continued opposed position. The reduction to 48 hours reduces the concerns that are laid out below, but it does not remove them. This will limit the board's ability to respond to the most recently available materials. Are there any board member comments?
Fran, I'm sorry, we muted you while Gabe was giving his presentation,
Okay.
so you'll have to unmute. Yeah, thank you.
Okay, I did. Gabe, I didn't hear you at the end. We had previously taken an opposed position. And
yes.
Your recommendation is?
Our recommendation is a continued opposed position.
Okay. Okay. I am going to move and oppose on AB 2028.
Morrow, second.
Moved by Burton, second by Morrow. Is there any board member comment? Any public comment?
I see, excuse me, I see Meredith, is your hand up? Or were you trying to second?
Well, I was seconding, and so then I was just going to ask: are we no longer using the raised hand?
The hope is that we will continue to use the raised hand. But do you have any other additional comments or questions?
No.
Thank you.
Is there any public comment? And DC moderator, can you please facilitate the line for public comment on AB 2028?
Thank you, Member Burton. I have opened up the question and answer panel. So if you would like to make a public comment, please type "I would like to make a comment" in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions for your reference. This is the moderator, and Member Burton, I am seeing no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
All right, I've closed it.
Okay, the board is taking an opposed position on this bill. Board Secretary, would you please call the roll?
This is Joanne Pacheco. Agenda item 14B, AB 2028, State Agencies and Meetings. Motion by Burton, seconded by Morrow. Motion details is an opposed position. I will call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Yes.
Laren, aye. McKenzie?
Yes.
McKenzie, aye. Medina?
Medina, aye.
Medina, aye. Morrow?
Morrow, aye.
Morrow, aye. Olagi?
Yes.
Olagi, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, yes.
You, aye. Motion passes.
Thank you. The next bill is AB 2113. Gabriel, would you please give a brief summary of this bill?
Of course. This is Gabe Nevin, Legislative and Regulatory Analyst. 2113 is a bill that would require boards to expedite and authorize boards to assist the initial licensure process for applicants who have refugee, political asylee, or special immigrant visa status. And this bill clarifies that it does not otherwise change the requirements for licensure. So the board already has a process for expediting certain licenses. So this would be adding these three classes of applicants to that process and making the corresponding updates to workflow processes. It's expected to be minimal, have a minimal impact, and staff are recommending a support position. This is good policy, and we already have a process for this expedite process.
Thank you for that, Mr. Nevin. And so what this bill would do is add political asylum and special immigrant visa and refugee to the classes of applicants. Is there a motion? Well, I'm going to move a support for this bill. Is there a second?
Dr. Morrow has his hand up.
You know, I'm not, this is like hands up for the blind. Okay, Dr. Morrow.
Ms. Burton, I'm happy to assist and let you know who has their hand up.
Okay.
Dr. Morrow, are you seconding?
You're muted, Dr. Morrow.
Dr. Morrow, you're muted.
I'm sorry, yes. No, I wasn't. There we go. Okay, yes, I second, but I have a question too before we move on. What is the operational meaning of expedite?
So the process that we have for expediting, as it has been explained to me, is that an application will go to the front of the line for that day that it comes in, and will then be processed as opposed to in line behind all the other applications.
Okay, thank you.
Okay. And did you second that, Dr. Morrow?
Yes, I did. I seconded it.
Okay. So this has been moved by Burton and second by Morrow. Are there any board member comments? Other board member comments? Are there any public?
I don't see any hands raised.
Okay, but now I do see Steve Morrow's hand.
I think he.
Now it's gone.
Yeah, I forgot.
I was sleeping at the wheel.
Hand.
I'm sorry. I was sleeping at the wheel.
Are there any public comments? And I'm going to ask the moderator to please facilitate the line for public comment.
Thank you, Member Burton. This is the moderator, and I have opened up the question and answer panel. If you would like to make a public comment, please type. I would like to make a comment in the field in the lower right-hand corner of your screen and submit it to all panelists. If you're not seeing this field, click on the question mark within a box at the bottom middle of your screen, and we are displaying instructions as well. This is the moderator, and Member Burton, I am seeing no requests for comment at this time. Would you like me to close the Q&A panel?
Yes, please.
All right, it's closed.
Board Secretary, would you please call the roll?
This is
AB 20.
AB 2113. Motion by Burton, seconded by Morrow. Position of support. I'm going to call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Abstain.
Laren?
Aye.
Laren, aye. Mackenzie?
Yes.
Mackenzie, aye. Medina?
Aye.
Medina, aye. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Yes.
Olage, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, aye.
You, aye. Motion passes.
Okay, our next bill is AB 2520, access to medical records. And I'm going to ask Mr. Nevin to give us a summary of the bill and make a recommendation.
Thank you, Fran. This is Gabe Nevin again. AB 2520 is going to increase the circumstances in which a healthcare provider, including a dentist, will have to provide patients or their representatives with copies of medical records for no charge. Currently, dentists are required to provide patients with copies of medical records, and they're required to do it free of charge if the request is in relation to an ongoing appeal for eligibility for a public benefit program. So this bill is going to expand the definition of public benefit programs to include cash assistance programs for the aged, blind, and disabled legal immigrants, and government-funded housing subsidy or tenant-based housing assistance programs. And it would also require the records be produced at no charge for applicants who are petitioning for non-immigrant status under the Victims of Trafficking and Violence Protection Act. This bill is also going to prohibit a healthcare provider from charging a fee to a patient for filling out those forms, and is going to require the healthcare provider to provide the responsive information on the form as opposed to providing it in a format that is easier or faster for them. And board staff are recommending a support position on this bill. Fran?
Okay. Are there any board comments? Is there a motion on AB 2520? Okay, I'm going to move the support. Is there a second?
Second, Lai.
The bill has been moved and seconded. Are there any public comments? DC moderator, can you please facilitate the lines
Thank you,
for
Member
public
Burton.
comment?
This is the moderator, and I have opened up the Q&A panel. If you would like to make a public comment, please type, "I would like to make a comment," in the field in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions on the slide. This is the moderator, and Member Burton, I'm seeing no request for comment at this time. Would you like me to close the Q&A panel?
Yes, please.
All right, it's been closed.
Okay, AB 2520 has been moved and seconded. Board Secretary, please call the roll.
This is Joanne Pacheco, agenda item 14B 2520, access to medical records. Motion by Burton, seconded by Lai. Position is one of support. I'm going to call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Yes.
Laren, aye. McKenzie?
Yes.
McKenzie, aye. Medina?
Aye.
Medina, aye. Morrow?
Laurel, aye.
Morrow, aye. Olage?
Yes.
Olage, aye. Pacheco, aye. Stewart?
Stewart, yes.
Stewart, aye. You?
Yes.
You, aye. Motion passes.
Thank you. The next bill is AB 2549, Salas. The board took an opposed position on this bill in June. Have there been amendments?
Yes, there has been an amendment since then. The previous bill was going to require that the reciprocal license that is called for in this bill would be converted into a standard license within 12 months if the licensee demonstrates that the requirements for the original license out of state that they had are equivalent to the California license. And that has been removed, which is probably a positive step, but is not really change our thinking on this.
Are there any board member comments? So let's be correct and take a motion on this bill as opposed, AB 2549.
Steve Morrow has his hand raised.
Dr. Morrow. Dr. Morrow.
You're muted, Steve.
He was unmuted.
Dr. Morrow.
He was unmuted.
Okay.
This is Morrow. Am I on base?
Yes.
Okay. Yeah, if I didn't come across, I move that we maintain our opposed position on this bill.
Okay. And the other hand that I see is Dr. Yu.
Yes, second. You second.
Okay. The bill has been moved and seconded. Are there any public comments? DC moderator, can you please facilitate the line?
Thank you, Member Burton. I have opened up the question and answer panel. If you would like to make a public comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions for your reference. This is the moderator, and Member Burton, I'm seeing no requests for public comment. Would you like me to close the question and answer panel?
Yes, please.
All right, it's closed.
This is AB 2549. Madam Secretary, would you call the roll?
This is Joanne Pacheco. This is agenda item number 14B, 2549, Department of Consumer Affairs, temporary licenses. Motion by Morrow, seconded by you. Position details is position of opposition or opposed. Going to call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Laren, aye.
Laren, aye. Mackenzie?
Yes.
Mackenzie, aye. Medina?
Aye.
Medina, aye. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Olagi, yes.
Olage, aye. Pacheco, aye. Stewart?
Stewart, yes.
Stewart, aye. You?
Yes, you yes.
You, yes. Motion passes. Thank you.
Thank you. The next bill is AB 3045, Gray and Patterson. And this is a bill on veterans and military spouses. Mr. Nevin, would you give us the details on this and recommend a position?
Yeah, this bill was presented to the board in May. The board took an opposition position and we sent a letter. Nothing else has changed with this bill, but we did want to bring it back in front of the board because it is moving and give the board an opportunity to take another position on it. We are not recommending a change from the previous opposed position, which was taken in the May meeting. Excuse that typo.
Are there any board comments? Is there a motion?
Yeah, this is Stewart. I'm sorry. Dave, could you give us the reason why, some of the reasons and the thinking behind opposing this bill?
Yeah, sure. So this bill is requiring, this is another reciprocal licensing bill. that is going to extend eligibility for temporary licenses to military spouses and to honorably discharged veterans. And the issue is around the differences in the allowed duties between California and other states. And so I went through and looked at the allowed duties for RDAs in all 50 states and compared them. And we have, there are states where there are no RDAs. There are states where higher level RDAES are not allowed to do things that RDAs do in California. There are states that allow, and it goes both ways. There are states that allow unlicensed folks to do things that licensed RDAs do in California. What it boils down to is that it doesn't make sense, excuse me, to have a reciprocal license unless the duties are close enough to the same that you have an expectation that everyone who is going to get one of these licenses is going to be familiar with all the duties that they're going to be allowed to perform in California. And that just simply isn't true. And I mean, for that reason alone, that we have thought that it was worth opposing. And then on top of that, what it will do is it will create a huge workload for the board, because we will have to, anytime we get one of these applications, do an analysis of that state's licensing scheme and the education and allowed duties, and make a new determination that will add a significant amount of workflow to the board's schedule.
Thank you, Gabe. That's helpful.
Ms. Burton, it looks like Dr. Laren and Dr. Felsenfeld have their hands raised.
Yes, I'm just moved to continue opposing this bill.
And I will second that.
Ms. Burton, your mic is muted.
Is there any public comment? And if you would please, moderator, if you would facilitate that.
This is the moderator, and thank you, Member Burton. I have opened up the question and answer panel, so if you would like to make a comment, please type, "I would like to make a comment," and submit it to the host. If you're not seeing the Q&A panel, click on the question mark within a square at the bottom of your screen. This is the moderator, and Member Burton, I'm seeing no requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
All right, it's closed. Thank you.
Madam Secretary, would you call the roll on AB 3045?
Yes, this is agenda item 14B, AB 3045, Department of Consumer Affairs, Boards, Veterans, Military, Spouses, and Licenses. Motion by Laren, seconded by Felsenfeld. Motion details his position of opposition, and I will call the roll. Burton?
Aye. Burton, aye.
Aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Aye, yes.
Laren, aye. Mackenzie?
Yes.
Mackenzie, aye. Medina?
Aye.
Medina, aye. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Olagi, yes.
Olagi, aye. Pacheco, aye. Stewart?
Stewart, yes.
Stewart, aye. You?
You yes.
You, aye. Motion passes. Thank you.
Thank you. The next item is SB 878, Jones. And we're getting there, members. Mr. Nevin, would you, first of all, this was a bill that we took a watch position on in February. Would you talk about any amendments to this bill?
Yeah, of course.
And give us some background on it, please.
Yes, so this bill is going to require that the board on a quarterly basis display the current average processing times for initial and renewal license applications, or the combined average processing time for both on its website. And unfortunately, the initial analysis that is down below was incorrect. The board actually posts anticipated processing times and not average processing times. So this bill is going to require updating reporting requirements and data collection practices, and it's likely to create additional workload. Therefore, staff are recommending an opposed position.
Are there any board member questions? Is that clear to everybody?
Sarah, this is Karen. I'm just checking. Was that our staff recommendation?
Our staff recommendation was watch.
I thought it was watch as well.
Yes, I thought it was watch too.
Excuse me, guys. That is my misspeaking.
The staff recommendation is watch on SB 878. Are there any board member comments? Dr. Stewart, is your hand up?
Just to move.
Leftover. Is that a leftover hand?
No, it's a current hand, but it's just to make the motion to accept.
Okay. The bill is moved by Stewart. Is there a second?
I think Meredith.
Meredith was first.
Okay.
Yeah, second.
Okay. Moved by Stewart, second by McKenzie. Is there any public comment? DC moderator, if you would please facilitate the lines of public comment.
Thank you, Member Burton. I've opened up the question and answer panel. If you would like to make a public comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and submit it to the host. We are displaying instructions for your reference as well. This is the moderator, and I am seeing no requests for public comment at this time. Would you like me to close the question and answer panel?
Yes, please.
All right, it's been closed.
And I'd like the secretary to call the roll, please.
This is Joanne Pacheco. Agenda item 14B, Senate Bill 878, Department of Consumer Affairs, license application processing timeframes. Motion made by Stewart, seconded by McKenzie, and it is a watch position. I'm going to call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Yes.
Laren, aye. McKenzie?
Yes.
McKenzie, aye. Medina?
Aye.
Medina, aye. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Olagi, yes.
Olagi, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, yes.
You, aye. Motion passes. Thank you.
Thank you. The next bill is SB 1168 by Morrow. Excuse me, by Morrow. The board took a watch position on this bill in June at our June board meeting. Mr. Nevin, are there any new amendments to this bill?
Yes. So this bill is going to require state agencies to allow anyone submitting an application to defer their fees if they have been if they have experienced economic hardship as a result of a virus. So this is directed at some relief for licensees as a result of the COVID pandemic. That deferral period was supposed to last 60 days, it previously lasted 60 days beyond the end of the declared emergency as a result of a virus. The amendments have removed that 60-day lead time. So it will just end at the end of the declared emergency. And staff are recommending a watch position again. That change we don't see reason to change the previous position.
Are there any board member comments? Dr. Stewart.
I move to adopt.
Moved by Stewart. And I will second. Are there any public comments? DCA moderator, can you please facilitate the lines for public comment?
Thank you, Member Burton. I've opened up the question and answer panel. Please, if you would like to make a public comment, type "I would like to make a comment" in the lower right-hand corner of your screen and submit it to the host. And we are displaying instructions for your reference. If you do not see the Q&A panel, please click on the question mark within a box at the bottom middle of your screen. Thank you. This is the moderator. I'm seeing no requests for public comment at this time. Member Burton, would you like me to close the Q&A panel?
Yes, please.
All right, it's been closed.
And Madam Secretary, would you call the roll, please?
Yes.
SB 1168.
Thank you. This is Joanne Pacheco. Senate Bill 1168, State Agencies Licensing Services, motion by Stewart, seconded by Burton, and it is a watch position. I will call the roll. Burton?
Burton, aye.
Burton, aye. Chan?
Chan, aye.
Chan, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Yes.
Laren, aye. McKenzie?
Yes.
McKenzie, aye. Medina? Medina? We'll circle back. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Olagi, yes.
Olage, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, yes.
You, aye. Medina? Medina? Medina absent.
I had it muted on my phone as well. It's
Okay. Medina?
aye.
Medina, aye. Motion passes. Thank you.
Thank you. Okay, the last bill is SB 1474. And members, you received an update on this yesterday or the day before. I'm going to remind you that when we started talking, and the first bill was AB 613. And I mentioned that some amendments from that bill had been added to SB 1474. But this bill, I'm going to ask Sarah Wallace to present, please, and give us a recommendation on the position.
Good afternoon. This is Sarah Wallace, Assistant Executive Officer. As Board Member Burton mentioned, this bill was amended yesterday, and so all board members received updated meeting materials in the form of an email yesterday. The updated agenda item was posted on the board's website for members of the public, and I believe the DCA moderator is also showing a file with the updated agenda item information for members of the public to download if they don't have it readily available. I'm sorry.
Oh, this is the moderator. I was just going to say that's correct.
Okay, thank you. So SB 1474 is the Senate's omnibus bill. The omnibus bills are typically run every year by the Business and Professions Committees in the Assembly and in the Senate. Those bills are typically reserved for technical, non-controversial cleanup language. It's an opportunity for programs, specifically DCA boards and bureaus, to be able to submit cleanup language that helps with the facilitation of our business processes or cleanup technical issues that we've found throughout the year. What occurred yesterday was language that was originally in Assembly Bill 613 was taken and placed into AB 1474. And at this point, it is a very long bill, but as it relates directly to the dental board and to the dental profession, this bill makes an amendment that expands the definition of laboratory director to include licensed dentists. At this point in time, staff doesn't see any concern with this portion of the bill. The second component of this bill that relates to the dental board is relating to the administration and acceptance of exam results for the WREB exam. If you'll recall, as the board was going through sunset review over the last 2 years, the board had made the policy determination and had requested that through multiple discussions that their sunset bill specifically specify the components of the examinations that are required for licensure. And as a result, on January 1st of 2020, the Business and Professions Code Section 1630 was updated to include that all dental licensing examinations needed to assess competency in the areas of diagnosis and treatment planning, restorations, endodontics, periodontics, and prosthetic dentistry. Prior to January 1st of 2020, the WREB exam had allowed candidates the option of not taking the prosthodontic section of the examination, and up until December 31st of 2019, exam results that did not include the prosthodontic section on the WREB exam results were accepted for dental licensure in California. And what this bill is doing is essentially reversing that provision to allow candidates who took the exam prior to December 31st of 2019 to apply for dental licensure via the WREB examination without having to have taken the prosthodontic examination. And so the board staff at this point, I don't know that we have necessarily a strong position other than this is reversing the policy that the board has already determined, and board staff does not believe that this is cleanup language or technical language, but is a policy decision that needs to be made. Additionally, this exam would, or this provision would be in effect until January 1st of 2025, and so up to the next 5 years, we would be accepting exam candidate results who took the WREB exam without the prosthodontic section of the exam up through December 31st of 2019. Now, it's my understanding that the board receives a lot of discipline and enforcement cases relating to prosthetic dentistry. And I will defer to Karen if you want to add additional information on that.
Thank you, Sarah. This is Karen Fisher, Executive Officer of the Dental Board. I think that when the board, when this particular information was inserted into our sunset review, the argument was that since California does not give a specialty license, that the requirements for the 5 competencies should exist, and candidates coming in to licensure in California should show essentially that they've passed exams in those areas. That the prosthodontic section in some cases was elected by candidates not to be taken. That section can still be taken. They can go back to REB and take that exam. Also, these candidates who had taken the REB earlier did have the option to apply at the time they finished the REB. So there are other options for them rather than to just grandfather them in to this particular bill at this point.
And that concludes your presentation?
Yes.
Okay. I would like to, I want to go back to Sarah's explanation and explain that because this is an omnibus bill, and because it doesn't meet the criteria for something that is non-controversial, I would like to move and oppose on this section of the omnibus bill. Is there a second?
Lie, second.
Sorry, Meredith had her hand up first.
Okay, Meredith, you got it.
Yeah, I can second. No problem. So that was exactly my question, Fran. So thank you for clarifying, or my point on that one. So thank you.
Okay. Okay. I think the other thing that I would add is that I think that we got a pretty specific signing message from the governor about how you do policy. And that for me is the other reason that I want to oppose this section. Are there any board member questions? Are there any public questions? And I'd like to ask the moderator to facilitate that, please.
Thank you, Member Burton. This is the moderator, and I have opened up the question and answer panel. If you would like to make a public comment, please type "I would like to make a comment" in the lower right-hand corner of your screen and send it to the host. If you are not seeing the Q&A panel, please click on the question mark within the square at the bottom middle of your screen, and we are displaying guidelines as well. This is the moderator, and we do have Mary McCune asking to make a public comment. So Mary, I will let you know when you've been unmuted, and please remember that there is a 2-minute time limit, and I will give you a 10-second warning. All right, Mary, you have been unmuted.
Hi, Mary with the California Dental Association. CDA is in strong support of the entire bill. I'm going to limit my comments specifically to this portion of the bill, though. This portion is really intended to clean up unintended consequences of AB 1519. It was the legislative intent of this bill to have the codification of all of the competencies for the licensure exams going forward and not to have anything retroactive. The folks that took the REB exam prior to January 1st, 2020 had no reason to go and take the PROST. It was not a statutory requirement at the time. And during that time, even though they had the ability after receiving a passing score to go and apply for licensure, prior to this year, they actually had an indefinite amount of time to apply for licensure opposed to going forward. They only have 5 years to have kind of a fresh exam score. And this is really reflected in Assemblymember Lowe's intention, not only in AB 1519, but also the legislature, as they feel that it is not controversial or substantive enough to the point that they put it in the omnibus bill. There is no opposition to this, which is another reason why it was placed into this omnibus bill. And so for those reasons, we strongly urge the dental board to refrain from taking an opposed position on this bill. Thank you.
Thank you. And this is Moderator Member Burton. We have no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
All right, I will close it.
And Madam Secretary, I'd like for you to call the roll, please.
Thank you. This is Joanne Pacheco, agenda item number 14B, Senate Bill 1474, Business and Professions. Motion by Burton, seconded by McKenzie. Motion details is in opposition position. I will now call for the vote. Burton?
Burton, aye.
Burton, aye. Chan?
No.
Chan, nay. Felsenfeld?
Felsenfeld, nay.
Felsenfeld, nay. Lai?
Lai, yes.
Lai, A. Laren?
No, Laren.
Laren, nay. McKenzie?
Yes.
McKenzie, aye. Medina?
No.
Medina, nay. Morrow?
Morrow, yes.
Morrow, aye. Olage?
Olagi, yes.
Olage, aye. Pacheco, aye. Stewart? Stewart? We'll circle back. You?
You, yes.
You, aye. Stewart?
Stewart, yes, sorry.
Stewart, aye. 1, 2, 3, 4, 5, 6, 7, 8, aye, and 4, nay. Motion passes. Thank you.
Thank you so much. Before we go on to the next item, I neglected to, for the record, to ask earlier that all of the bills that we need to get letters on, that we do that as expeditiously as possible. So if you would, Mr. Nevin.
Okay, and will I be delivering a letter on all of the bills that we took positions on, or is there a specific subset that you would like to see letters on?
Gabe, we'll get it handled. Okay. It'll be expedited, Board Member Burton.
Okay, thank you. Thank you. Okay. The next item is 14C, discussion of prospective legislative proposals.
This is Sarah Wallace. This is a standing agenda item where stakeholders are encouraged to submit proposals in writing to the board before or during the meeting for possible consideration by the board at a future meeting.
Okay. I see none. The next item is item 15A, pending regulatory packages. Mr. Nevin, if you would please present this agenda item.
Of course, this is Gabe Nevin, legislative and regulatory analyst for the Dental Board. Starting with basic life support equivalency standards, board staff have drafted initial rulemaking documents. Legal counsel has reviewed those documents and approved them. staff have received updated fiscal materials on June 17, staff sent updated fiscal materials to the budget analyst on June 17. And when those are approved, we will be able to submit the initial rulemaking documents to the department for approval. And we've just had, they're doing a big push on the substantial relationship criteria stuff. And so we have a number of things that are out with budgets right now that are taking a backseat to the substantial relationship stuff. So just as a heads up, there will be a couple things like that. So the next one is citation and fine. We completed, the last time that we were before the board, we were finishing the public comment period. Since then, we did not receive any public comments, and drafted and completed the final phase rulemaking materials, which were sent to Legal Affairs on June 16. Those were approved and submitted to the DCA director on June 25. And when they are approved by the director, we will be sending them to OAL for final approval and implementation. The next rulemaking is the continuing education requirements, opioids rulemaking. During the development of this rulemaking, regulatory counsel found some clarity issues that are going to necessitate bringing this back before the board. Specifically, the proposed language would allow licensees to receive up to 3 credit hours for volunteer work. However, there is not a formula for calculating the amount of volunteer hours worked, how that will translate to CE credits received. So we expect to bring this back in August. The dental assisting comprehensive rulemaking is still in the drafting stage. We have approved the board has approved the proposed language, and staff are currently working on the forms that are going to be going along with that language. When those are done, we will be bringing them back to the board for approval. The determination of radiographs and placement of interim therapeutic restorations rulemaking. We just received responses to the drafts from legal counsel. So we will be doing another round of drafting on those rulemaking documents before we send them back for legal approval. And once that is received, we'll submit the initial rulemaking documents. The diversion committee membership rulemaking has been drafted, and we've recently received comments on that rulemaking as well that will necessitate another round of drafting before submitting to the department. The elective facial cosmetic surgery permit application requirements and renewal requirements rulemaking has been drafted. We're working with legal counsel and approving those, but we are currently waiting on some feedback from our budget analyst on the rulemaking's fiscal impact. So once budgets approves our fiscal documents, we'll be able to move forward with submitting this rulemaking. The law and ethics examination score rulemaking, we had finished drafting that rulemaking and submitting documents last year, but this year we have encountered a number of clarity issues that have resulted in a new language proposal being developed. And so we're working with regulatory counsel, and we will be presenting that in August. The mobile dental clinic and portable dental unit registration requirements rulemaking. The initial rulemaking documents for this rulemaking have been drafted, and we are working with board legal counsel to approve those before submitting them to the department. The minimum standards for infection control rulemaking has been drafted, and we're working with legal counsel to review those documents. Once those are approved, we will be submitting the initial rulemaking documents to the department. The substantial rulemaking, the substantial relationship criteria rulemaking went through its, board members will remember that we presented modified language and public comments at the May meeting. And since that time, we have finished the final phase materials and sent them to DCA. They were approved and sent to agency on July 9. And on July 20, we received comments from agency, and we're currently working with regulatory counsel and budgets to turn around a new draft. And finally, criminal conviction inquiry section 100 rulemaking was necessitated by the larger AB 2138 bill. This rulemaking has not been presented to the board because AB 2138 requires boards to amend their existing regulations governing substantially related crimes and acts and remove statutory authority to require applicants for licenses to disclose all criminal convictions. The existing California Code of Regulations, section 1028B16, which previously required disclosure of all criminal convictions, was removed as as a non-substantive section 100 change. This rulemaking was completed on June 19, 2020, and is effective June 10. And that is because the reason for the disparity in those dates is going to be because there are notice requirements after the rulemaking is effective. So there were a few more things that board staff had to do even after the rulemaking was effective. And that concludes this report.
And Mr. President, it's back to you.
Once more, sorry. Let's move and see if there are any board member comments on those updates. Seeing none, DCA moderator, could you please facilitate the lines for public comment?
This is the moderator. Thank you, Mr. Board President. I have opened up the Q&A panel. If you would like to make a public comment, please type, "I would like to make a comment," in the lower right-hand corner of your screen. We are displaying instructions on the slide. If you do not see the Q&A panel, click on the question mark within a square at the bottom of your screen. This is the moderator, and Mr. Board President, I am seeing no requests for public comment at this time. Would you like me to close the Q&A panel?
Thank you, yes.
All right, thank you.
I believe we are now moving to agenda item 7. No, I'm sorry. Let me back up.
Dr. Stewart, I think we're on agenda item 16.
Thank you. I needed that help. I lost my place. Okay. Agenda item 16, discussion and possible action regarding meeting dates for 2021. Ahoa, would you please present this agenda item?
Yes, thank you. This is Tahua, Administrative Analyst for the board. Historically, the board has met quarterly, once in San Francisco, once in Los Angeles, and at such other places as the board may designate for the purpose of transacting its business. Should it become possible to have quarterly in-person meetings again in 2021, the board will need to set the meeting schedule to provide adequate time to negotiate contracts for meeting space locations. A 2021 calendar is attached for your reference. The calendar includes dates for holidays and association meetings. So the action requested after discussion is for the board to select specific board meeting dates for 2021 from the table displayed on page 387 of the meeting materials.
Thank you, Pahua. How do we work through these dates? Do we go to the first square, February 18, 19, or February 25, 26?
Yes, please.
Anybody have a conflict or a preference?
Looks like
I
Dr.
do.
Dr. Felsenfeld has his hand raised.
Yes, Dr. Felsenfeld, thank you.
Thank you, Tom. You almost called me Alan. That's perfectly fine. The only comment I want to make is please understand that the 25th and 26th of February butt up against the AADB meeting in Chicago the very next 2 days, if anyone is planning to be there. That's all.
Thank you, Alan. Did I hear Meredith?
Yes, I had lost my little hand for a while, so I couldn't, but I found it again. I have a conflict on February 18th and 19th.
Okay. How do we do this, Karen? What's the appropriate way to make that determination? Do we set a date, pick a date, and take a vote?
Yeah. I'm not sure we have to take a vote. I think we just need to see if there are any objections to February 25, 26. It looks like, though, we got a lot of hands up. So Dr. Felsenfeld has hands up, so is Ms. Burton, Ms. Pacheco, Meredith. So Dr. Stewart, if you want to take their comments first.
Yes, let's do that. I'm just going to start with Joanne Pacheco.
Hi, this is Joanne. Just a question. How far out are we going virtual like this?
We don't know.
That's the question. We don't know. We really don't know. All we're doing is trying to set tentative dates so that we can do some preliminary planning for places.
Okay, thank you.
I see, what other hands? I'm looking. I'm not seeing. The hands went down.
The hands went down.
All right. How about doing this, 25, 26, and if you agree with those dates, put your hand up. I see 1, 2, 3, 4, 5, 6. Looks like we've got a date.
Well, not really, because we need to have a quorum to have a meeting. And if you have 6 people, if you have others that are saying they're not available.
We have 8 hands.
Do we have 8 hands now?
We have 8 hands.
I think you have 9.
Okay, if we've got 9, then
yes, we have 9.
And Michael, we don't have to necessarily take a vote on these, do we? Or we just have to come up with a consensus? Michael, we haven't heard from you today.
This is Michael. This is Michael Knutz, legal counsel. I don't think a motion is necessary here. Perhaps to approve the calendar once you have it finalized.
Okay.
All right, so we have, it looks like we have February 25, 26, and I think May 12, 13 is pretty set because of its proximity to CBA Presents. Is that in agreement? Can I see some hands raised on May 12, 13? One, two, three, 4, 5, 6, 7, 8, 9, 10. I think we've got May 12, 13. Can we go to August?
Great job.
Okay, let's, anybody have a preference? Let's just say August 19, 20. August 19, 20. Again, okay, 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, August 19, 20. Anybody have a preference between November 18, 19, December 2, 3?
I would prefer November 18, 19, 19, because the later date always falls on my wedding anniversary. Every single year. Every time.
All right, let's try November 18, 19. Looks like we have consensus. So do we need, Michael suggested that we take a vote with those tentative dates.
This is Michael Knotes. If you're finalizing the calendar, that would be a good time to take a vote on that. I'm not sure if you're finalizing the calendar at this point or if that'll happen at a future meeting though. So I think that's up to y'all.
Well, being in the, so much is up in the air, Karen, we're tentatively finalizing. How do you want us to proceed?
Dr. Stewart, this is Michael again. I do think that that's an appropriate juncture then to take a motion and approve the calendar.
Thank you, Michael. All right, then I will accept a motion to approve that calendar. And
so moved. Pacheco.
I just have a question first, please.
Yes. Yes.
What's the August date? What is the August date?
I think it was 1920.
I think it was 1920, Fran.
1920.
Okay.
How about February?
25, 26.
Okay, thank you.
I just want to mention that is also the midwinter meeting in Chicago. That date, 25, 27.
Yeah, Dr. Felsenfeld mentioned that, but I think I might have been the only one that explicitly has a conflict the previous week. But yeah, the 18th, 19th, I have a conflict because that's President's Week. So I always have a conflict every year.
Okay, I think we have consensus. Do we have a motion?
Yes.
And a second?
Pacheco moved. You have no second yet.
Meredith, would you like to, I see your hand up.
Yeah, I'll second.
Before we do that, because we've popped all over the place, can you specifically state the 4 dates, please?
Yeah, Fahua, would you please help me with that? You wrote them down?
Yes. So I have February 25th through the 26th.
Yep.
May 12th through the 13th.
Yep.
August 19th through the 20th.
Yes.
and then November 18th through the 19th.
Thank you. All right, we have a motion and a second. I'd like to ask the secretary to call the roll.
Okay, roll for the meeting dates that Raul just mentioned. I'll take the roll.
Burton, aye.
Burton, aye. Chan,
Aye.
Chan, aye. Felsenfeld,
Felsenfeld, aye.
Felsenfeld, aye. Lai,
Lie, yes.
Lai, aye. Laren,
Aye.
Laren, aye. Mackenzie,
Yes.
Mackenzie, aye. Medina, Medina,
Aye, I'm sorry. Aye.
thank you. Medina, aye. Morrow,
Morrow, aye.
Morrow, aye. Olage,
Olagi, yes.
Olagi, aye. Pacheco, aye. Stewart,
Stewart, aye.
Stewart, aye. You,
Yes.
you, aye. Schedule passed.
Thank you. I think we are now moving on to agenda item 17, public comments on items not on the agenda. Are there any public comments on the items not on the agenda? DCA moderator, can you please facilitate the lines for public comment?
Thank you, Mr. Board President. This is a moderator, and I have opened up the question and answer panel. If you would like to make a comment, please type, "I would like to make a comment," in the lower right-hand corner of your screen and submit it to the host. If you are not seeing this panel, please click on the question mark within a square at the bottom of your screen. And I see we have one request so far for public comment from Claudia Pohl. So Claudia, I will let you know when you have been unmuted, and please remember there's a 2-minute time limit. All right, Claudia, you've been unmuted.
Thank you so much. Yes, Claudia Pohl with CDAA, and in this regard, also speaking for KDAT and the Daggers. We would like to express again our concerns about the law that allows dental assistants to work for up to 12 months before needing to meet the requirement for infection control education, as found in BPC 1750. Our concern is now heightened as we are returning to work in the midst of the COVID-19 pandemic. As published in the California Department of Public Health, and I quote, "According to OSHA's guidance on preparing workplaces for COVID-19, dental healthcare personnel are in the very high-risk category for exposure to SARS-CoV-2 virus that causes COVID-19 when they are performing certain aerosol-generating procedures. This risk requires a level of heightened awareness, training, preparation, and adherence to a combination of standard and transmission-based precautions is appropriate to ensure safe provision of care," end quote. So we don't believe that the current laws reflect this need. Given the mission of this board to protect the public, we request that the board reevaluate the minimum qualifications relative to infection control for dental assistants as found in BPC 1750. Thank you.
Thank you, Claudia.
All right, this is the moderator, and we have no further requests for public comment. Mr. Board President, would you like me to close the question and answer panel?
Yes, and thank you.
Thank you.
Well, we are getting to the end. We will now move to agenda item 18, board member comments on items not on the agenda. I see a host of hands. Abigail, I see your hand is raised.
That was from earlier. I'll go ahead and remove it.
James, same.
Same, sorry. Forgot to remove it.
Lilia, Lauren?
Same thing here. That little hand hides.
Ross?
I have one comment, general comment.
Sure.
general comment is I would really like to have the future assisting consul to be more involved with things, the dealings of assisting, and we go through a lot of assisting agenda, and I rarely hear inputs from them. So my hope is that the new members will come out stronger, have an opinion, and help us through this journey. Thank you.
Thank you, Ross. Well, friends, I believe that concludes the dental board meeting. I know I'm on my way to Lowe's to get a thicker pad for this chair for these meetings. But unless I hear further comment, I'm going to call adjournment. This meeting is adjourned.
Thanks, everybody.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you and goodbye.
Moderator, thank you.
Thank you. Bye.